All right. Good evening, everyone, and welcome to Sisters for Harmony. I am one of your hosts, Dr. Kathleen Walls, and I am, of course, joined by Ed Umoja Herman, who's going to open us up in a moment. And our other co host, Ruby Burke, unfortunately won't be able to join us tonight. So, Brother Ed, I'm going to have you open us up, and then we're going to introduce our guests.
Wonderful. Well, first and foremost, we greet everyone in the name of God. We greet everyone in the name of God and the ancestors in whose footsteps we most humbly walk. We enter the space to share the knowledge with our global community so we could enhance and empower everyone who's listening.
Mm-hmm. Definitely.
Amen.
And so we have some fantastic guests on tonight who definitely work towards the community, help us with the community. And let me see here. For whatever reason, I am hearing feedback. So let me take care of this feedback and then I can move past it. All right. So, Brother Umoja, would you take the mic for a moment while I deal with this feedback issue?
Oh, sure. Well, family, tonight, even though the organization Sisters for Harmony, we're going to be focusing on men's health. Because as much as we love our sisters, we know we need the brothers in there too, healthy and strong and focused. The yin and the yang is always present in our family. Mm-hmm. So, Dr. Walls, are you back yet?
I'm back. Thank you very much for that.
That was good. That was good, Brother Umoja. You held it down for 10 seconds.
You know, he was worth marrying. So, you know,
I keep her around for things and it's like a little bit of this, a little bit of that.
So yes, but you're absolutely right. I mean, this is real. Men's health is so important, and whether it's a mate, a family member, a friend, whoever, we got to make sure y'all health is on point. And sometimes you need us sisters to poke you and be that extra sense of support. But then you also need your additional male brethren to make sure you're staying healthy. And I know Dr. Motley, one of our guests tonight, who is a pharmacist and a community advocate and activist. That's right. Always holding it down with her partner, George Mink Jr., the street practitioner, who is also a community advocate and activist. And they do so much. It is really amazing. But when you know what your calling is, you just walk right in it. And I'm gonna have you talk about it. And Dr. Natasha Ramontal, y'all are used to seeing her. And if you just meeting her and seeing her for the first time, she also does so much for the global community. She sacrifices herself and travels around the world.
Somebody's got to do it.
Somebody's got to do it. To find these resources for you, and then goes back a second time to make sure what she found the first time was right. So we appreciate your thoroughness. That's right.
Thank you.
The whole job. Gotta get the whole job done, not just half.
That's right. So Dr. Natasha, come on and again reintroduce yourself to the people, and let's start this conversation.
Sure. Thank you again for having me. I'm Dr. Natasha Ramontal. I am actually a nurse, emergency department, but I've been working in a number of different areas since. And I have a YouTube channel called Medical Tourism RN, where I educate Black women on any aspect of medical treatment or surgery that they're looking to seek outside of their home country. So I just kind of give them education on what they need to know if they're going to places, predominantly places that they end up are places that don't, where physicians treat people that don't look like us. So I educate them on, you need to make sure they understand this in order to make the best decisions for you, and for you to also make the best decisions about whatever type of treatment or healthcare they're going to decide to go on that journey with.
Mm-hmm. I thought about you the other day when an Edmonds mentees came by and talked about how she went and had her dental work done in Colombia.
Yes, popular place.
Yeah, and that's what she said. She said several of her friends went to Colombia to get their dental work done and legit flew out on a Friday had the work done on Saturday and Sunday, and flew back Sunday night in time for work on Monday.
And it probably costs less than
Yeah.
just even one visit to talk
Yes.
about what they do in the United States.
Yes.
Yeah, I know quite a few people that go there regularly. Like they have braces, and if you're familiar with braces, you have to tighten them every couple of weeks. They said going back and forth from Miami to
Yep.
Colombia, the flight on, say, Spirit Airlines, that's what they chose to fly. It was so much cheaper than just paying for one visit for the braces.
Mhm.
So they do it regularly.
It was amazing. Yeah, she talked about in the package that she purchased, it took care of her dental visit. They also gave her a hotel room for an evening that was less than $100. And the equipment that they had was phenomenal. She was saying things that she didn't even see here in the States.
That is
And
common.
then she had to get something, but they ended up doing like porcelain. And so the quality was just up, up, up. And
Yeah.
she said that, most people would have you think that it isn't, but it was fantastic.
Yeah, the U.S. media will have you thinking their healthcare is the only healthcare out there, and that everywhere else is deplorable. But honestly, the technology is high quality, depending on where you go, and a lot of times it's more in the city than it is in rural areas. But you'll find that you can save anywhere from 40 to 90%, depending on where you go and what you're going for, and not only for dental work, for any type of healthcare. So it's an option that a lot more Black people in particular are seeking. And a lot of that has to do, I work predominantly with Black women, and we're finding that they don't feel heard, which is why they are deciding to go elsewhere for the care. So many other people are leaving in general or doing the nomad thing for 6 months or a year in another country. And they're raving about the type of healthcare. I mean, the US is the only place where your healthcare is tied to work. If you do not have a job, then you have to seek something else. But it's a part of the system in other countries, which shows you how valuable it is. You don't have to have a job to go and seek treatment, and you're not charged obscene amounts of money to be seen and cared for.
Can I add in something there? Just the flip
Yeah.
side of this. I know that the media inflames a lot of the stories around medical treatment outside of the U.S. And I suppose that there is some truth to the risk of going outside of the U.S. for healthcare treatment. And so I want the audience to know, or to get some understanding of, how can you tell if you are dealing with a reputable provider or not?
Yeah.
Do you have anything that you can share,
Yeah,
Dr. Ramontal?
absolutely. And I share that on my channel all the time. So I tell people I do what I would do, and I'm actually in healthcare. So I would I go to the Joint Commission International, which is a reputable regulatory body that in the US, they are in charge of making sure that hospitals and any type of clinics, laboratories, anywhere healthcare is delivered is accredited. And it's really stringent, it's global, and it's it's known for not giving in, right? So that's where I'd start. And because I start there, what happens is they have a global arm. So I would look for facilities that are accredited by the Joint Commission International. And that leads to the providers that work there having to keep up their credentials as well. So some people say, do I look for the doctor first or do I look for the facility? I kill two birds with one stone and go with the accreditation, because you cannot work there unless you're keeping it up. And they actually have other guidelines where you must post those that information on the credentials, et cetera. And if something goes wrong, it's usually publicized, and they will shut you down in a minute. Like if they go there are times, so they go for their regular accreditation every 3 years, but if you have someone calling in and saying, I witnessed something, they will come and do a surprise visit. And if they find it to be true and it's something that's putting anyone at danger, they will shut it down.
That's good to know. Thanks so much for sharing that.
No, my pleasure.
Yeah, that's awesome.
Dr. Motley, I was actually going to come to you next, because I wanted to share with the audience, you have an organization called Health Educated.
I do.
And so let's tell the people a little bit about you and what you do in addition to being a pharmacist.
So thanks for inviting me to the show, because I've been watching and I'm like, when I'm gonna get my turn and go on and tell my story.
So today is the day.
Today I have made it. My bucket list. Let me pull it out, cross it off. Y'all want me start singing up in here.
George, do we
George,
give it a
ain't nobody
chance?
asked you.
Hey, let's go. Let's get the choir ready.
Oh, no, George, please watch that choir, but she'll pull a tambourine out in a second.
Oh yeah, yeah. I know she got it ready. There she go.
Yeah, there she go. Okay.
Health Educated is a nonprofit organization that works to advance health equity, address health disparities, and promote health literacy, particularly for marginalized communities. And so we do that in 3 ways. We do that by exposing young people to advanced careers in healthcare, which we did at our Dream Expo in April. We also do that by putting boots on the ground and hitting the streets and sending out the street practitioner and a whole health educated team to places where people don't expect to get health information. So we show up at basketball games and football games, like youth sporting events, concerts, like wherever we know that people are going, we're picking up the phone saying, hey, can we set up a table to do some blood pressure screenings? Can we hand out information about cancer screenings? Can we be there to do COVID vaccines or flu shots or whatever it is that we are doing at the time? We, show up in those unconventional places to make sure people have information they need to make good health decisions. We're not telling anybody what to do. We just putting the information out there, letting them come to their own conclusions, because it's complicated, because you're hearing stories from everybody. So we just give our little perspective, our humble perspective, and let people make decisions, but they can't say they didn't know. Once they come across our table, they can't say, nobody told me, I didn't know. Oh, if you have your initials on our paper, we got proof that somebody told you. So that's the other way. And then the last way that we do our work in the health equity, health disparity space is we train healthcare providers on how to take better care of patients that come from marginalized groups. And we do that through continuing education programming. We have a big summit coming up in September, where we're going to have physicians and pharmacists and nurses and dentists, and we're going to provide the providers with skills and training that they just don't get in school and at work a lot of times. And so we're expecting them to come to work and be culturally competent and cultural humility, and to put up their unconscious biases and all that, but no one ever teaches them how to do that.
Right.
And so that's the work that we do, because I'm just tired of hearing the same story after decades and decades. It's like the story is not changing. So I'm grateful that the Lord just puts resources and ideas on me, and I'm just able to do a little thing to help to move us in the right direction in terms of health.
And you have a fantastic partner that joins you in a lot of this work, sir. Would you please introduce yourself?
How you doing? How you doing, everybody? My name is George Mink Jr., the street practitioner. It basically was an easy buy-in for me when me and Doc first met. It was during the heavy season of COVID, and we were just trying to get our folks, to be aware that the vaccine is okay. It's not an experiment. It's pretty much the only way things are going to open up. So we started out like that, and we connected. I already was a part of the community through gun violence awareness, homelessness, pretty much anything across the board. I was a mentor. So it was just a win-win when we first got together. So now I'm like the head outreach guy out Chester. We pretty much on everything. I mean, it's just good to hear from a black person perspective. Our folks like to hear from our people sometimes.
Yeah.
So that's where me and Doc come in at. We just good, regular, wholesome folks, and we just want y'all to catch up.
Yeah.
That's pretty much where I'm at. Like, we want to catch our people up. We so behind, and for certain reasons, that's okay. But it's just time for us to start catching up.
Yeah. And you
So
too
that was
also
the
do a
buy-in for me.
podcast. You do a podcast also.
Yes. We do the podcast, Keeping It 100. It pretty much was me in the streets talking to our brothers. I started out with the barbershops. That was used to be a safe haven for brothers to go and talk. And I just started talking about health. Let's start working on our health, brothers, starting with me. You know, with the vaccinations, you know, getting your testings and screenings, and it's just been consistent, and it's been working.
Mm-hmm.
So now we're on blood pressure and all these other quality things that I got to catch up on myself. I'm not going to say too much.
You don't want me to get started.
Doctors looking at me.
We gonna come for you. We coming
Right.
for you.
But it's been a blessing though, just to be able to get back, especially from this perspective. There's not a lot of nonprofit organizations geared towards, you know, health awareness or, you know, just catching us up on the latest of what's going on.
Yeah.
I mean, Doc was on, like, she worked for the CDC that when we was going through the
Shut up.
but it was like a blessing though. And it was like people started trusting us and believing in things we were saying.
Yeah.
And we were actually living through the things we were telling the people to do, and you know, what was better for them.
Yeah. Yeah.
Yeah.
I love that. I know as we were preparing for this show, Dr. Ramontal, you came across some statistics that I was blown away regarding. Go ahead.
Yes. So I know the topic, you know, I deal predominantly with Black women, but I was looking at some of the top leading, well, the 10 leading causes of death in the US for Blacks on a whole. And they broke it down between Black women and Black males. And I wasn't as astonished because I knew, but I didn't realize both women and men stuff mirrored each other so much. Like out of the 10, numbers 1 and 2, which actually number 1 is heart disease, and cancer's number 2 for both men, Black men and Black women. And then you have number 7 through 10 are the same, which 7 is chronic lower respiratory disease, asthmas and everything along that lines. Kidney disease is number 8, septicemia is number 9, and hypertension is 10. But what was interesting was actually numbers 3 through 6 mirrored each other, but the ranking was different, right? So the ranking for men for stroke was number 4. For women, it's number 3. For Black men, diabetes was number 6, but for women, it was number 4. And for Alzheimer's, for men, it was number 3 for Black men, and for Black women, it was number 5. And there was only one difference in the top 10 leading causes of death for Black men and women. And for men, number 5 was homicide, which is not on the women's list. And for women, Black women, number 6 for them was unintentional injuries. And that's anything unintentional, like motor vehicle accidents, suffocation, drug overdose, drowning, poisoning, burns or a fire, falls, or some type of sports and recreational accident. So I just thought this is really interesting that we mirror number 1 almost identically, and then seeing what the difference was, the one difference, which was homicide versus unintentional death, injuries. They call it unintentional injuries.
Dr. Motley, you knew some of those numbers. What was going through your mind?
Mostly the fact that a lot of this hasn't changed over the years, like decades. And the other thing that comes to mind is how much of this is preventable.
Yeah,
exactly.
And how much of this is because of racism in healthcare or institutional and systemic racism. That, you know, that's a whole topic we can talk about, and environmental racism and the impact of the environment on Black people who are at a higher risk of being exposed to environmental factors that negatively impact their health in the first place, and at higher risk of not having insurance, not having a high income to be able to pay for healthcare, not having transportation to get to a healthcare provider, not having a healthcare provider close to their neighborhood, like all the things that lead to the poor outcomes of having bad health that they even can't control. So yes, these diseases are preventable, but there are so many factors that people can't even control, that you really even can't expect them to prevent it. It's unbelievable, and it is sickening, and it's embarrassing. It's an absolute atrocity to be in this country and to think about the disparities that exist between Black people and white people
and others. Right, because
well, and especially Hispanics.
yeah, that's where I was going.
You'll see the same rates, high rates of the same types of diseases in the Hispanic community for the same reasons. And so it is really disheartening. It really is, and I don't know. But that's what goes through my mind when I hear about stuff like that.
Got you. Brother Umoja, I'm going to slide you in first, and then George, I'm coming to you. What's going through your mind?
Well, as we said, I'm listening to talk about preventive maintenance. But, since I grew up a lot during high school and sometimes through college, I worked in grocery stores. And when I was in Florida, I worked in a grocery store predominantly in a white community. And when I was in New York, I worked in a grocery store predominantly in a Black community. To see the quality of the foods that comes into our community. And you don't know it until you step out of the community and you see other places. So I was kind of blessed that I saw it in the different communities of color and non-color. And it was always interesting to me how the people who delivered the stuff and how they worked in the communities to make sure that this community got this and this went over there and that went over there. And I was always constant, somewhere, somehow, someone's making a lot of money on this. Because you cannot tell me that you look at the quality of the foods or some of the foods in African American in communities of color. You look at the quality of the foods and it's different than the quality of foods in non-Black communities. So you have to stop and think, so why is it? We both pay taxes to the same city or state. Okay. So why is there a difference? And so it makes you start to wonder how we should look at our healthcare, because they're not looking at it. So we need to we should be looking at it in the first place anyway. They're not looking at it, and I hate to say, I don't like saying it, but it comes down to a money thing. We could sell this here, and we can't sell it over there. So let's move it over here where we could sell it because there's less regulation or oversight over here. So we could do it over here because people are not paying attention over here. So we could slide it in over there. And also with some of we see a lot of chemical plants in areas where people of color live, or where there's a high concentration of people of color. You find certain plants. Production plants in certain places, and then when you go to other communities, you hear a very large roar from the people, comes down to the people, saying, we don't want this in our community, take it somewhere else. And when they say take it somewhere else, it usually is taken to our community. So once again, we need to have a voice, and like when we're talking about the health, so we have to have a voice, and we have to put a foot on the hands or on the door of our local officials to what they say yes to come into the community. And the thing that irritates me, Dr. Walls, one of the catchphrases they use a lot is that this is bringing more jobs into the community. I'm like, bringing more jobs at what cost? And I think we have to be conscious about that.
Yeah.
George, and they don't always bring the jobs. I'm sorry.
Yeah, no.
They don't always bring the jobs. They just say it to get in there. But when you look at the numbers, the jobs aren't there. And just as you said, at what cost? Like, how is it worth it? How is it worth it when you have this entire community that's going to be negatively impacted by this for how many jobs? And then what they're going to do with that money if they can't even have good health? But you can go to George.
You're ready to pull out the stand. I just think about survival. I mean, we got complacent, like throughout generations. We always was catching up. Like, so when I look back and I think of our communities, we got used to these things. We got used to living like this. We got used to our young men killing each other now, or we got used to always cooking macaroni and cheese and chicken at all our events.
Got greens, beans, tomatoes.
Right. I mean, we got used to. So when 9 times out of 10, if somebody having an event, they are all the foods that's going to tear you up. We serving. So I mean, it's just part of our traditions. and the dysfunction stuff, man. We just got used to it.
Yeah.
So it's like now, to me, the remedy is, I mean, things what we're doing now, but we got to attack the youth.
Yeah.
We got to go after the youth so they don't start another generation of continuing all these behaviors.
Yeah. You know what, George, as you said that, it made me think about a couple of years ago, I was working with an 8th grade class, and I had them do, in psychology, we call it a genogram. In lay people's terms, it's really a family tree. Okay. And so looking at the different generations, and what I had them do was put down the health conditions in each generation. And so they started to see where high blood pressure, diabetes, all of these health, and they started getting nervous, and they were just like, basically like, I'm destined for this. And my thing was, you're not destined for it. You may have a likelihood for it if you continue on this path. But you now, young person, have an opportunity to make some health choices that are different than those that came before you to lead you to a different health outcome. So, taking that preventative word and getting them to start looking at, you do have control over many parts of your health, right? And when we're talking about health, and that we also have to recognize, we're talking about mental health, obviously, right? Emotional health, physical health, financial health, relationship health, right? We're looking at health in all of those forms. So, and this is important for women and men, but it's men's, right, awareness month. And I know as of late, there has been a bigger push, really, since the pandemic, for men's mental health awareness. And what has that been like for you as someone who goes out into the community? I mean, you can bring in any and all aspects of health,
Right.
but what's that been like for you going out into the community and talking with men about their health?
I mean, it started out being taboo.
Mm-hmm.
We're speaking about it more frequently now, but I think the problem is redefining like the black man. So we already had a stigma of the head of the household, the James Evans style, just working for nothing and just, trying to make ends meet. So that's been the black man mentality to always, make money, and that will solve everything. So you take on all your pressures, you pick up a couple bad habits. So you might smoke, you might drink, whatever, you pick up, or whatever habits you use that. But it's just like going along with, now we know that that's starting to kill us.
Yeah.
That's part of, that's one of the lists. That's on the list, as the doctor told us earlier. And I mean, working in a community is rough. I mean, it's hard to break that mental cycle. I mean, but it's levels to the mental health. So like, I feel like depending on the age of the brother that I'm talking to, it depends. So if we start strengthening their mindsets at a younger age, and breaking that cycle of just being this hard black man, and this is how you black men. All black men, this is the game plan. It's wrong, man. You got to get that stuff out. You got to get into your spiritual mode. You got to have personal, relationship with yourself, before you start sharing yourself. And I had this, I'm actually just like entertaining these things now.
Yeah.
So it takes a while, but I'm glad like it's starting to be the topic of discussion all over the space, especially through our people.
Yeah.
And a lot of brothers, I know a lot of brothers that have therapists now.
Yeah.
Yeah, they have therapists, they have therapists. They want to talk about their stuff. They want to get it off their chest. They talking to their women more. And certain women are opposed to it, though. So we these brothers is getting mentally strengthened. But some women, they not used to that style of man. So we need
that's very
we
true.
need women to be, to coincide with the brothers trying to catch up with their mental health.
Yeah.
Because once we start embracing it, You got to kind of work on yourself to match the energy, or we're going to have a lot of arguments.
There we go.
Hello.
Yes. Yes. I see that Light Session TV said men do not like to discuss their health issues.
No.
I think,
go ahead, Brother Moja.
I think it's just not just we don't like to discuss it. I think when you look, if you never change the program, like in a computer, the program will continuously run the same.
Mm-hmm.
So when we look back to our fathers, our grandfathers, and our great-grandfathers, it was like a set thing that we don't talk about this because, like Georgia said, we're the head of the household, or we got to be strong for the family. There was a lot of reasons why we didn't speak about it. And no one has changed. No one has really sat down to change that program back then. So now, one thing I love about now, you see, like, for example, LeBron James, he does a lot about his health. You know, he just takes really good care of himself. He talks about his health. So when we have these athletes, some of these athletes who are talking about their health and taking better care of themselves, because you had those back in the day, they came off the court, off the football field, and they went to the club, and you saw them drinking the 40 and they're doing this. So they wasn't really looking at their health like that. But now you see them today. You have more and more athletes not talking about their health. And when you have athletes, these high-profile athletes talking about it, it's going to trickle down to the everyday, the kids in high school and the kids in college talking about it also. And you know, so even like Coach Prime, he didn't do too much about his health with his foot. That's why he has a serious problem. So now he's talking about it, and he's making sure he talks to his kids up at Colorado about it. So it's going to take a lot of us looking consciously to change the program, because the program was set way before us. And that's where the sisters come in. The sisters who come in and ask those questions. I know I have a wife, and she's always asking me, how am I doing? What is this? What is this? And I'm cool with that, because it doesn't bother me, because my son, I used to do that with my son a lot. And so, because I made the conscious decision to change the program, because I realized there was a program in playing when I was up in Brooklyn, New York. I saw there was a program playing, like I said, I was in a grocery store, and it didn't make sense to me. Why this was so much. You go 5 blocks this way, you see something totally different than when you go 5 blocks that way. It's like, what's like,
as you're saying that, you know, I'm thinking about what George had said. Some things were or may have been functional back in the day that are now dysfunctional now. And so we have to make sure we're assessing what we're doing, instead of, in your words, Edmund, you know, being on a program, just continuously running a program out of habit, because it is not functional anymore. It is not serving us anymore. And we have to constantly make those adjustments. And to your point, right, we have to ask our loved ones, how are they doing, and actually listen for the answer, and to pay attention to them enough to know when they're functioning correctly and when they're a little off. And I'm also surrounded by people who will send me messages to check on you and make sure things are being done correctly. Go ahead, Dr. Motley.
I mean, I ain't gonna expose all the privacy. No, but you know, there are things that need to stay the same, like the village. Like it absolutely does take a village, and it's not just to raise a child. It's like from the time you are here to the time you go, we need everybody looking out for each other, and we have to do more of that. We have to continue to do that. We have to do more of that, making sure we're checking in, and you know, holding ourselves accountable to caring for other human beings. I think a lot of that has been lost. And it's been extremely detrimental to our community, to the minority community for sure. People just, it comes down to money and power is what I am learning more and more every day. And it is money and power, and that's what drives decisions.
Yep.
Yeah.
But it takes reconditioning also, because even what George mentioned about we're just used to doing this over and over, generation after generation, that is very true, because it's just always been done that way. But you have to recondition people to think in a different way. Oh, I need to put my health as a priority. You know, I worked in the emergency room where you had people who had a problem when honestly, if they had addressed it from the moment they felt it, it would have been in a much better situation. They go to work and keep going and saying, I have this, I have that, I can't do this, I can't pay attention, and work until it's, I used to say, till it's falling off. And that's when they come to the ER and it's like, fix me now. And they think that it's going to be fixed when it's something that's more serious by the time they actually get it checked.
Yeah.
So it does take a lot of reconditioning for our people, especially, I think, because a lot of times it's, well, that's what my grandparents did, and that's what my parents did, you know, and it's a new day. And I find that some of the younger generations specifically are really taking their health into account. And when you show them how it is tied to finances, like you said, Dr. Motley, they start looking at it, oh, this is a game. And I just don't know how to play the game. When you start looking at how much pharmaceuticals are on the stock market and how much they make with you being sick, they start saying, oh, okay, well, I'm going to go ahead and invest in that pharmaceutical, but I'm going to take care of myself with a plant-based diet or with fruits and vegetables and just vegan, vegetarian, whatever it may be. So they feel like they're getting over on the system, so to speak.
And it's so important. One, and George, I think you said it earlier, right? First, you got to know yourself, right? It's so important that you take time to know yourself, because you have to know when you're feeling off, right? If you don't know what your baseline is, then you don't know that something's wrong. I remember talking to my father. I was about 45 minutes away. I was working out at a school, and I just felt the need to call him. And so I called him, and he was like, oh, my arm is feeling kind of numb, and I'm having a little difficulty breathing. And he said, and of course, what am I doing? I'm like, those are all the signs for a heart attack, right? And so, and now mind you, my father was a veterinarian. His father was an MD. So it's not that he didn't know what he was saying out his mouth. So I said, Daddy, I said, I need you to go to the hospital. Oh no, George, I'm telling you, this is what this man says to me on the phone. I listened to myself with the stethoscope and everything sounds all right.
Oh, wow.
Oh my God. Sir,
Woo.
if you don't take yourself to the hospital right now, right? And I'm trying not to buck up on my father because it's my father, but I can't believe what I'm hearing. And I said, Daddy, if it were me or anybody else, what would you tell them to do? And he said, fine, baby, I'm on my way. At which point I lost it. Like hung up the phone with him and then was trying to figure out how am I going to drive 45 minutes to get to the hospital. But he took himself to the hospital, and guess what? He was having a heart attack.
Wow.
And so it's like, come on, we need y'all men to care for yourselves the same way that you vouch that you care for others.
Yeah, that's true. And to bring up the point, it's a movie. I don't know if you probably are familiar with it. It's John Q.
I thought you were going to bring that up.
Denzel was this brother's regular hardworking brother. And, you know, he basically salvaged everything to save his child. But it was one part in the movie I remember, and the wife was like, John, do something. So she put this brother on the spot to do whatever he had to do to fix it. And I feel like a lot of our sisters, or like even in the generations, that's what's being bestowed. That's what's being put on us, that kind of pressure. That brother died. He did everything. He done held the whole hospital hostage. He did all these things. He had to sell everything to try to get the heart transplant to keep his son's name on the list while she sat there and cried. You know what I'm saying? So it's like sisters want us to step it up. That's fine, but in order for us to get that mental health, our partners play a big part in that.
Yeah.
And that's been kind of the dynamic over throughout the years. She said, John, do something. And he done took that gun and went in there and just still had to go to jail. He still had to go to jail at the end of the movie. And I use that as an example, you know, as far as like a mental health piece that I was talking to some of the kids with at the school.
Yeah.
It's like, we don't want to get put in those positions where we're making these type of decisions and these desperate decisions or whatever the case may be, you know, because it was all mental decision.
Yeah.
But that's what we kind of face with, though. A lot of these brothers, they face with that type of pressure. And not necessarily just from that woman, but from society, from now social media, from like, you know, the perception of being rich. You know, that's always been a theory in the Black community. Everybody wants to be rich or, you know, well-to-do. But it's so much pressure on us alone. And then we fighting everything. We fighting systems. We fighting racism. I mean, even you as a doctor, you still have to deal with racism. Y'all still got to deal with racism on a regular basis. I'm talking about in major, you know, major facilities. So it's certain things, especially for a male, like with this mental health piece, that we got to kind of expose. And we want to need some participation from family and even of the community. Like, you know, they expect certain brothers to help change these young men. We got to get help ourselves first. So we came through the same streets they came through. We might not have been doing it to this level, but in order for us to help the youth and these young Black men, with fathers or without, we got to get ourselves together. Y'all got to stop putting the pressure on us to the individual, and we got to do it as a unit. So I feel like once brothers start coming together as a unit, you know, the communities and the village that Doc was talking about, it has to be rebranded. So I always said it has to be put in new soil. So it's not going to stay. It's no way we getting the old village back. We're not getting the village from the 70s and the 80s and the 90s. It's a different village now. It's a different world. It's a different community. It's the same love for the community, but we got to rebrand the soil, and you got to start with our men. So, I mean, the mental health piece is big, but the expectations, you know, it depends where it's coming from. So.
I'm going to slide to Brother Umoja in a moment, but Dr. Ramontal, I feel like you got something burning inside of you.
No, I was going to say we all have to be allies towards each other. Black women, Black men in particular, we're talking about that right now. And I was just thinking that so many homes, Black homes, are led by Black women who have decided to take their mental health more seriously now because of the amount of stress and anxiety that they face because they have had to be, unfortunately, head of so many households. But I also think that once we each recognize how important mental health is, because it is stigmatized in every community, honestly, but especially in our own. And I find that once we get over that, and I think that honestly, even they always say something good comes out of something bad. And with the pandemic and losing so many lives, I will say it shined a really bright light on mental health and the importance of it, because we all had to isolate ourselves, right? Even the people that you are just accustomed to seeing family members every day, you now had to think twice, should I go over there? Because I might put them at risk because of the job I have or where I go. Let me not go over there. And you're calling now instead of physically hugging them when we all need touch. So it's really interesting. And I'm actually glad that that is something positive that came out of the pandemic, because I do find that a lot more people that look like us are having the conversations about the importance of mental health. And it's not stigmatized to now talk to someone. Before it used to be, oh, you crazy. Everything is you're crazy if you're going to go see someone, right? But it really is an inability to cope. You have a lot going on. You have stresses of daily life, family life, work life, whatever else you want to do to achieve whatever it is you desire to achieve. And it's a lot of pressure. And if you don't have an outlet, it's going to affect you physically.
That's right. That's right. God, you know, I can jump all over everything you just said. Look, but I'm going to hold my rein for a moment. Go ahead, Brother Umoja.
Me?
Yeah, you.
You know, I'm listening to the conversation, and just makes me think, I think we need to change the flavor or the angle we look at mental health.
Okay.
Because when you say mental health, a lot of people think of a sickness.
Mm-hmm.
I think when we must redefine what mental health is in its totality.
Mm-hmm.
Mental health is just saying that I need a chance to exhale. I need a chance to breathe, to get a breath in. Does that mean I need to talk to someone? Does that, for me, I tell my wife all the time, when I come home, it's my little heaven. I come home and I relax, I de-stress. I tell my wife that all the time. Because as a Black man, when you walk out there, and George could say, I'll talk about this, when you walk out there as a Black man, there is so much against you just because of the color of your skin and being a male.
Right.
So when you come home, you just want to de-stress. And I think your partners need to understand that. Women need to understand that, because sometimes we will come home and I tell my wife that sometimes I just come home, I'm quiet too. I don't say nothing to her because I know it's not going to come out right. So I just go in my room and I relax and just chill out and de-stress myself. So sometimes it just comes down to mental health. I think we need to put an additional, not a different, an additional covering on it, to where it's an opportunity for you to de-stress, exhale, and take a fresh breath. And that might mean I need to talk to somebody. I need to go for a walk in the park. I need to go to the gym. What do you do to de-stress yourself and get a breath, take another breath? And I think maybe if we put an additional covering or a new covering on top of the one that's there, I think people would look at mental health differently. It's just, I just need to relax. What do I do to relax? And then the question is, what do you do to relax? And then that's a big question for some people. What do you do to relax?
Yeah.
And I think that's one thing we could do, because I know it works for me. My wife knows that. I come sometimes, I'll burn sage in my room and all kinds of stuff, because I need to relax, because it's been a hectic day out there. Even though someone cut you off, you talk about what's it, road rage? What's road? How does that get to that point? Someone is really stressed out to go to that extreme all of a sudden. So when did they ever have a chance just to exhale, go for a walk in the park, or do something just to calm themselves down? So I think we might need to look at mental health with an additional covering to help bring more men to the reality that they need to de-stress themselves. They need to take that extra breath.
Dr. Motley, what you thinking?
I'm just glad we're talking about it. And just like Brother Umoja mentioned, the more that we can have celebrities and influencers come out and talk about these topics and get people's attention, the better we'll be. And I think that will start to change the conversations and change the mindset as we work to destigmatize, especially men having a therapist. Yeah. We just got a grant to allow us to go out into the streets to promote mental health education. And so we'll be at all the places doing Q&A sessions with people and giving out like little handouts and goodies to support their own mental health, and to teach adults and to teach children about and have conversations about different mental health topics. And so I'm proud to really have an opportunity to do that work, because just like we're all saying, it's just so important.
Yeah,
it's so important.
I know you had an event in the fall. Was it in the fall that you had it, and you had Philly Freeway come talk about his health situation? Why don't you tell the people a little bit about that and why it was important to have him come out and talk about?
Yeah, so that was the Healthier You conference. That was our fourth iteration of that event, and it was just an event where we bring out healthcare providers and specialists and experts to talk about what their expertise is. So we had Dr. Walls in the building, of course, doing her mental health thing, of course, and we had a number of providers. That we had a woman that teaches people how to grow their own food. We had a parenting coach to talk about preventing parent burnout. We had a panel of Black male physicians to talk to the men about their health and mental health, and have these conversations. So it was a really, really nice event. But I was honored to have Freeway there, because he has been through a number of health challenges, and he understands everything he's been through, and he understands why, and he just tells a good story about his transition from being diagnosed with high blood pressure and diabetes, being on the wagon, falling off the wagon, that leading to him having kidney disease, being on dialysis, then having a kidney transplant. On top of that, having to be a caregiver for his dad who had Alzheimer's disease, and then his son passing away, his daughter passing away from cancer, and so him having to go through the grief of all that. And so he just had a whole entire story that was so powerful, and he did a good job just empowering and educating, enlightening the people about how he navigated it, and providing them with tools on how they can get through those situations too. So it was good that he was a celebrity, so people would listen to him, but his message was so important, and I thought it was important for people to hear that.
Yeah. George, how about you? And for those people who don't know who Philly Freeway is, he is a rapper. He is from Philadelphia, very popular. He did a song with Jay-Z years ago, so he was, as far as in the rap community, people know who he is. So George, how about you? What was that like for you to hear him tell his story?
It was an honor because I actually knew him, you know, in his heyday. You know, we crossed paths a lot. And even just to see him transition, like Doc said, being aware of his health, his whole health. Like, I mean, he knew everything. He knew stuff like doctors wouldn't know. Like, he was even teaching Doc stuff, and it was just like amazing.
Yeah.
Like, and this is somebody, you know, that people, you know, look up to, whatever, but these was personal problems. So it wasn't this celebrity, you know, that we all have grown to love or known or whatever. This was the human version of this person.
That's right.
So, you know, we know him as Freeway, but this brother he went through everything that we go through or could go through on a regular day or any type of stage of our life.
Yeah. Yeah.
So that was like so amazing hearing him explain his story. And it's big stuff, man. He lost two children like within like years apart.
It was about a year.
Yeah, I mean, serious stuff.
Yeah.
Like, so it involved everything. It involved mental health. It involved, you know, health awareness. It involved all aspects of everything that we teaching and we trying to preach. So it was just a blessing to hear his story.
As Dr. Motley was sharing, because I didn't know about Freeway's story. I knew a little bit, but I didn't realize all of those health problems he had to deal with and family did. But as you're telling the story, I'm thinking that's the entire 10 issues on the list for leading causes of death. He had to deal with the child with cancer who died. He had the mental health. He had the hypertension, the diabetes, the heart disease. I'm like,
the Alzheimer's from his dad.
All of his there, all of that.
And his friend. His close friend was also dealing with the same health issues that he was, and wasn't choosing to make the proper health choices. So he was also combating that as well, which is how he started sliding off the wagon at one point, because he had a partner to slide with, and then finally having to choose himself again. And he opened up a lot that day. That day was the first day that he ever talked about his children in public.
Particularly his son. He would post about his daughter, but he never talked about his son. And he got really emotional around that. It was an incredible interview.
Yeah, it was.
So,
the other thing I wanted to add about his story is that he also participated in a clinical trial. And and for the Black community, that's huge. The clinical trial that he participated in, and wait till I tell y'all what he did in this trial. He received a kidney, and the trial wanted to determine, can the drug cure hepatitis C? He didn't have hepatitis C. They gave him a kidney with hepatitis C to see if the drug would cure it. He agreed to that trial. He participated, and it was a cure. The drug is now approved, but he was a part of that, and that is huge. You're not gonna give me no disease like you already telling me every day. Like, you gonna let you give me a disease? I'm not doing that.
And we Black, so we don't play that.
Right.
not doing that. Are you crazy?
We ain't go for that. No.
But he did that for us. You know what I mean?
Yeah.
He did that for us and for humanity. And so there is an approved drug, a number of them now, that actually cure hepatitis C because of people like him that agreed to be in the clinical trial. That is huge.
Yeah.
That is huge.
Dr. Motley, I know we. Yes, I was just thinking a tambourine shape for Freeway.
Tambourine.
Yes. Yes. All right. So Christopher Gibbs said, "Thank you for utilizing the platform to recognize Men's Mental Health Month for June. Kathleen, you're awesome." Aw. All right, Gibby.
Gibby. Shout out to Gibby for watching.
Brooklyn's in the house. So, Dr. Motley, you know, as you were telling that story and you think about all of the young people, you just had an event back in April with getting young people into the health profession and so forth. One, why is that important to you? And I also want you to circle back and talk about the importance of Black people. And Dr. Ramontal, you can talk about it too, the importance of Black people and historically marginalized people being in clinical trials.
Okay. I can start with that because I can make that real simple.
Okay.
It's important. It's important because if we're not included in the trials, they have to extrapolate the data or like expand the data and just make assumptions about how we're going to respond to it.
Yeah.
As opposed to they know what's going to happen because we are represented in the clinical trials. And so that's important, but it's not an easy decision to make because it's like, I'm not going to be a test dummy. And so when you look at the Tuskegee experiment, the studies that were done back in the day on Black women, the experimentation that was done on them and on other slaves, there is a history of mistrust in research since then. Although Tuskegee wasn't that long ago, it started, I think, in 1932 or like in the early 1930s. It just ended in the 1970s. So it's not like it was hundreds of years ago. My grandmother was born and she's still alive. So it's like, to me, it was like the other day. So it's not like it's that long ago. So yes, it's still at the top of our minds.
That's right.
Although people want to make us believe that, that was forever ago. No, it wasn't.
History.
No, it's not. But we know that there have been regulations and policies put in place since then, since that atrocity, that prevent stuff like that from happening again. So that gives us some reassurance. But it's not going to be we're going to be the first people in line for a clinical trial. So it's going to take a lot of education, a lot of outreach, a lot of trust building to get us involved in clinical trials again. And so Freeway had to trust his doctor. So he had to have a good, solid relationship with his doctor to get him to participate in a clinical trial.
Yeah.
And that was important. It was critical because if he didn't have a good relationship with his doctor, he wouldn't have done it.
Yeah.
He absolutely would not have done it. And so it's on the healthcare community to fix that. Yeah. It's not on us. We are the victims. It's on the healthcare community to fix that. So that's that part. I hope that wasn't too long.
Yeah, no, I will pause on that part. Dr. Ramontal, what else would you like to say about the clinical trial?
Everything Dr. Motley said, I agree with. And it is on us in healthcare. That implicit bias in healthcare is real. And there are a lot more studies, evidence-based studies that are coming out now showing that it suggests that racial bias can influence how doctors treat patients, potentially leading to misdiagnosis or just inadequate care for Black patients.
Absolutely.
And it's really difficult to rebuild the trust when you go to just primary care and they're not even paying attention to you or listening to, this is hurting me. Okay, that's fine. Because studies have proven that in the emergency department, Black patients, they do not get pain medication despite them saying it's at a level 10, which is the highest. And I'm talking about from children, Black children, all the way up to Black adults. They will give you Tylenol when it's something that is severe. So it's really difficult to gain that trust when the everyday communication with your clinicians is you have a sense of distrust. But I will say that those regulations they put in place, yes, that is a step. It's a good step and it's a major step. What I found is that more clinical trials, they're actually seeking more Black people to apply for the positions where they're over the clinical trials, because they feel that there's a sense of trust or credibility. If another Black person is saying, this is what this study is about, would you like to participate? I'm going to be taking all the data on it and I'll keep you informed. So there's a lot of room for growth for Blacks in that particular area running clinical trials. And it's simply because of the history of mistrust in this country.
Definitely.
I'm glad that you brought the trust piece up. I know, Dr. Motley, you and I really kind of discovered that reality when we were doing the vaccine hesitancy and those panels and so forth. And I know, Brother Umoja, we have dealt with that as far as primary care physician. And our primary care physician is someone who I trust and we have a great relationship with, because he was my father's primary care physician. And before my father made his transition, he introduced him to everyone in the family and basically was like, you're going to take care of my family. And he was a young resident or so at the time. And my father made his transition in 2017. And he has been our primary, my mother's, like, I can email this man and he emails me back within 24 hours. When he sees me, he knows who I am. He asks, right? And here's the thing, I know he sees a lot of people, but I am not a number to him. And we've built that relationship over time. He knows I care for my mother and so forth. And having that type of relationship is important. And now we've had other physicians where we have said, no, like you can't, because I don't feel like you really know who I am. Like you don't see me and you definitely don't hear me. And so we have to make sure that we are seeking out people who care for our overall well-being. And
Go
George, I
ahead.
know you mentioned, I'm sorry, go ahead, Dr. Ramontal.
No, I'm sorry. It's just piggybacking off of what you said. You were an advocate, and your father even was an advocate
Yes.
for his family's health. And
Yes.
then you, after that, for your mom and everyone else. And I have to say that it's so important for us to be our own advocates. We know ourselves better than anyone else.
Yes.
And if you don't feel comfortable speaking up, because there are people that just don't feel comfortable speaking up, they see physicians as a position of power, and whether it was something ingrained in them from a generation ago or just they're just not that type of person to speak up. If you can't, I always tell people, take somebody that can speak for you.
Yes.
Bring them in the room with you, or have them on the phone when they walk in to speak up for you, because it's not going to be done unless you have an advocate.
It's the truth.
That's true.
Somebody, one of my people just went to the emergency room the other night, and I was like, are you seen yet? And they were like, no. I was like, they got 15 more minutes, because I put my mother to bed because I didn't know if I was going to have to go up to the hospital and flex some letters in order for them to get the service that they needed. Because I don't want you looking at this person as a marginalized individual that you can treat any type of way. Now, I'll start with a phone call, and if the phone call don't work, then we'll move to plan B, which will be me up in the space. And then if I have to make some additional phone calls and emails, then we'll go that route too. So they hit me back very quickly to say I'm being seen. I said, okay, no problem.
I do the same thing. That's the same thing.
Yes, but
you have to.
It's
George,
a shame.
You mentioned the word partnership, and right, it is important. And that is a word that I think we have to embrace and get back to. Historically, when it came to African American relationships, there was an egalitarian type of relationship. And over the years, it has fluctuated. And so when we look at this idea of community and what community means now, I think is important, right? But when we talk about community overall, we have people looking out for each other, meaning in health and well-being in all areas, and being open to receive the help as well. And so it's a reciprocal relationship. When we have a partnership with each other, like Edmund and I, we're looking at each other and he's looking out for me and he's saying, I think you're tired. I think you're stressed. You need to relax. Why don't you go put your feet up? You put out a lot today and so forth, right? I need to be able to receive that from him, and vice versa. He needs to
Right.
be able to receive. I need to be able to hear him when he's stressed. When we first got together, he was like, "Oh no, I don't take vacations." "Oh, you won't take some vacations." And so
The whole thing.
I'm a hard-working American.
Yeah,
I
look,
don't take breaks.
No. I didn't take vacation because I enjoyed what I did. I just did it at a slower pace, and I went to the beach.
Yes,
I
you
went
did.
swimming. I did all that stuff. I love what I do so much. I don't vacate it for
That's
my life.
beautiful.
Yes, but guess what?
Yeah.
We went to the beach. While I was reading my book, he was
Oh yeah.
out of the eyelids. I said, for somebody who don't need a vacation, and that's how the video started with me taking pictures of him.
I saw that. I remember
Oh, right.
seeing that, getting all the naps in. Look at him taking another nap.
Yeah, that's right. Listen, I take my power nap. I'm I'm that black man who know I need a power nap. I take a power nap.
And he does.
Right.
But you right, again, you have to know yourself. He knows when he starts to wind down. He doesn't fight it. He falls into it. He restores himself. He gets back up. We've been trying to figure out a health situation. His blood pressure has been off. And it was like, what is going on? He exercises. He eats healthy. It was like, what is going on? And we were able to identify it the other day. But that's us actively looking at his life and his lifestyle, because I don't want him to go nowhere. Right?
No.
I need him to be healthy. I want him to be healthy. And so then therefore I'm
contract.
going that contract. That's right.
No.
Right. But we need
Brother George, help me, Brother George.
Hey man, listen. I got one myself. So
Come on, go ahead, George. She looking out.
we gotta talk off the camera, bro.
Email me.
No, say it right here. You a strong black man. Say it here.
Yeah, see, this the problem. See, look at the pressure.
But you know what, Dr. Motley, you just said something very, very, very key right there. Seriously, we strong black men need to understand strength is showing softness. It's showing reality.
Say it again.
Yeah. Embrace it. You said it.
Sometimes because saying you're strong does not, and showing your soft side does not mean you're weak. It says you're a real person.
Yeah.
Right.
You know, like one thing I did not, I could count on one hand and still have fingers left how many times my mom said, "I love you." So when my son was born, I made a conscious decision always to tell him, "I love you, and give him hugs." So today, he's 34 years old, and Kat could tell you when we on the phone, we say we love each other before we hang up. Yep. But I had to make that conscious decision to put that into my program because it wasn't in my program. And so we as men, if we say we are strong black men, we have to show that soft side of us so that way we are complete. It's not 350 degrees, not 310 degrees, it's 360 degrees. Just show all the angles of being a strong black man so that way we could help our children be better.
Right.
It makes you relatable and approachable too.
That's right.
Because when people feel like you don't understand because they've never seen you express that, they feel they can't come to you about that.
Exactly.
That's right. That's right. And we need it, right? We're human beings. We need that connection emotionally, mentally, physically. That's part of the human experience. And Edmund and I are now grandparents. We have a grandson and another little on the way. And, and so his son is telling his son that he loves him. So now here, George, as we're talking about generational programming, right? Edmund took the wheel and said, we're not going to repeat this into the next generation. And now our grandson will only know a person who tells him that he loves him and that it's okay for a male and a black male to say, I love you.
I think that's something we have to teach our young men because, and we have to just not just say the word, I love you. We have to help them to understand that when you say love has many aspects to it.
That's right.
And it's that we have to, loving the women by respecting them, don't call them out of their names. Do the things that make the community a balanced, good place to be. It makes it comfortable for everybody. And we Black men is something that we have to do more with. I love seeing, when I walk by the schools, I love seeing Black men, young Black men bringing their children to school. And they're holding their hands. That is something we have to do. We have to let those children feel good. Daddy's walking me to school. Daddy's walking me there. He's holding my hand. He's walking. And people see that. They understand that we are doing a process of love. That's important that we do that.
Yeah. Well, process of love. Dr. Motley, you have another event coming up for the community, and you and George and y'all love for the community.
Yes.
Tell us about this.
Yep. So it's the Get Your Head in the Game Forum. It is an event we're partnering with the Foundation for Delaware County to, provide men with all the things they need in their lives. And really, we all need this, but this one is just for the fellas. We wanted to create a safe space where the fellas can show up and feel comfortable, feel vulnerable, to share and to be open and to be themselves. And so I know my ladies want to come out, but this one not for y'all. I'm not even going to be in the room. I'm going to step out the room after I do a little welcome, but we are having a job fair. We're providing expungement resources, reentry resources, credit repair, parenting and co-parenting is the theme for the event. So the keynote will be on co-fathering, which is the concept where the dad and the stepdad have to get along and, communicate in a way that's productive for the child, for the other parent, and for the whole entire situation. So our keynote is on that. Our celebrity guest is PD Crack, and he is going to be interviewed about his experience in co-parenting and music and hip hop and the influence it has on young people. And so as a hip hop artist himself, he's going to bring in his perspective. We're also providing housing resources, education resources, mental health. I'm really proud to say that we are going to cover that topic during the morning sessions and again in the afternoon. So in the morning, we're going to have a speaker talk about a self-care toolkit for men in terms of mental health. And then in the afternoon, we're going to hit on depression, anxiety, and grief with another therapist. I'm also really proud to say that the planning committee, including George and a number of other brothers on the committee, I asked them, who do you want to hear from? Do you care who you hear from? You want to hear from women, from men, or what race? And they said that they want to hear from Black men. So we have a all-star lineup of all Black Hispanic men to give them what they need. And we're also going to be providing health screening. So I knew I couldn't call this a health fair, men's health, blah, 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 because they would not come. So I had to be tricky and strategic. I tried to call it the Gentleman's Club, but
that's cute.
They might take that the wrong way.
I wanted them to.
That would be catfishing.
So we came up with the gig forum, but it's going to be a really nice day, providing the men with all the resources they need, including health screenings. We're doing prostate cancer screenings, blood pressure, of course, weight loss, diabetes, foot checks. I just heard recently that another Black male is losing a limb due to diabetes. And so we are making sure that our men are getting their feet checked and learning why it's important, especially when you have a disease like diabetes. And so eye exams too. And we're also offering eye exams. So we're, just trying to plug in all the holes, raise awareness, raise the consciousness, and get, and tap in to men addressing all these issues that impact their health. They may not realize that housing, that education, that having a job, all those things are a direct link to their health. They are. It's called the social determinants of health. We don't have time to go into that today, but it's a real thing. And so I took all the social determinants of health and created an event to hopefully make a difference in the lives of the men of our community.
Come on. This is what I'm talking about as far as, right, Yes, it's Sisters for Harmony, but here is a woman who is actively working to make sure the men in the community are healthy. And there are a lot of us out there doing it. George, anything you want to add to this event?
I'm just excited. Like she said, all those things they go together. Housing is a big part. I know a lot of brothers, they never really had their own. They live off of women. It's like they don't start to look to have their own. It's like it's going to be like an independent forum.
I love it.
So it's how to get brothers, like, first of all, to get your head in the game is perfect.
Yes.
So it's just, we wanted to tie it into like a sports theme mindset. So that's what your coach would say. Get your head in the game.
Right.
You lunching, you out there, you're not yourself. Get your head in the game. So that's kind of the mentality. So I'm excited. Ready to talk to some brothers and just have some real conversations.
Yeah.
And hopefully the conversations will continue. And we'll start improving our community.
Yeah, I love it. Brother Umoja, what you have to say?
Well, Sisters for Harmony, the 4 is the number 4, stands for the 4 directions, north, south, east, and west. And to have harmony, you need a balance of yin and yang. You need male and female energy. So as we're addressing the male, as the females are addressing the male energy, the male are addressing the female energy. So it's a balance, it's a harmony. So Sisters for Harmony is doing what Sisters for Harmony is about.
That's right.
Bringing the harmony.
Right, because the reality is, right, when my father went through his health crisis, when Edmund had his health stuff, when my brother had his health stuff, it stressed me out.
Yeah.
Right? So my health is impacted by their health and vice versa. As I went through different health things, they're stressed out because they're worried about me. So we all work together, and we all put our hands in each other's hands and lift each other up. So, well, thank y'all so much for joining us this evening.
Yeah.
Thanks for having us.
Thanks for having us.
Oh, you're welcome. And let me ask you, Dr. Motley and George, the event, it's free to the public, and do they need to register?
Thanks. That's a good question. It is absolutely free. And they absolutely do need to register because Harris is counting the people as we give them numbers of who eating. So we need to know who coming to eat so we can make sure they pay for it. So they are getting breakfast and lunch, and we are asking everybody to register so that we have an accurate count. So you can go to healtheducatedinc.org, healtheducatedinc.org to register for free and be there.
And when do you need them to register by?
That's a good question. I think the last day is June 15th, so next Saturday.
Okay. So I'll make sure I send it out to a couple people, because you said a couple things on there where I was like, oh, I just had a meeting about that with somebody. They need to go. So, all right, y'all. So I have dropped the link in the chat. So for people who are on the Instagram side of life and or the LinkedIn side, you should be able to see it. But if you can't, come on over to the YouTube side of life at Ask Dr. Walls 525, so you can tap on that link at healtheducatedinc.org. You'll see the flyer, you'll see the registration form, and so forth. All right, Dr. Ramontal, where do people need to find you? Where do they need to follow you?
Oh, thank you. On YouTube is the biggest platform because I put out videos educating people. So my YouTube is Medical Tourism RN 812. I'm the only medical tourism RN on there, so you should be able to find me. But on all the other platforms, LinkedIn, TikTok, Instagram, Facebook, it is Medical Tourism RN.
All right, perfect. And in the write-up on YouTube, all links are there, so you can always come over. Sometimes on the other ones, they don't let you write up so much, but YouTube allows you to write up, so all links are there for people listening. George, where do people need to follow you, and how do they contact you?
Just follow me at George the Street Practitioner, and that's pretty much my only handle right now.
Okay. Now you're Georgie,
right?
The Street Practitioner,
right? That's true. It's Georgie, and I'm working on it now. I got to talk to Doc, so we tweaking my page now.
Yeah. Okay, sounds good. And Dr. Motley,
I clean some things up.
Okay, all right, because you do a lot of good work out there, and I don't want people not to know that. They need to know that.
And I appreciate it. I appreciate it.
Georgie.
This was a great night, though.
Oh, good. I'm glad.
Mhm.
Dr. Motley, how do people need to get a hold of you?
I am at Doc is on the ball. Doc is on the ball. Ball is my maiden name, so I had to keep it close to the family. Doc is. I was married now, but I ain't forget where I came from.
Right.
Like B-A-L-L?
BALL.
Okay.
See, get the head in the game. She got the ball. She on the
Right.
ball.
Exactly. It's all coming together.
That's right.
Doc is on the ball at on Instagram, and that's probably your best bet there. Yeah.
Okay.
Mhm.
And any other events or things that program-wise that people need to be aware of? Keep it 100, so forth.
The Keeping It 100 podcast is on a break.
Okay.
We are trying to secure funding to get us back up and running.
Okay.
But we have tons of episodes that are available at Health.Educated Inc. on YouTube.
Okay.
You can see Dr. Walls plastered all over the Keeping It 100 playlist, because we always ask her to come back and come back and come back. And in terms of events, our event for the community, the next event is the Healthier You Conference 2024. That's going to be on Saturday, November 2nd. That's a free event. And that's where we do all the workshops, the fitness demos, the food demos, exhibitors, health screenings, breast exams, like all that stuff. And the ladies are welcome. They always come out for that one.
Brother Umoja, you have stuff going on today and going forward. What would you like to share with the people?
Oh, well, we have our film festival going on right now. It's online. As you see the PIF Africa over my head. So we have a PIF Africa film festival going on. We have the Kadaga web series starting next week. So you go to the website. The best way to catch me is umojaphoto.com, and it has everything on there.
Fantastic.
Nice.
And we have an event coming up July 13th, which is actually my father's birthday, which is why it just fell out perfectly. Well, we will be having Froggy Tea and Bunny Community Day. And we are going to have some book readings, because I'm super excited that my latest came out and just showed up in the mail today.
Yay.
Oh, nice.
Yes.
Nice.
So
Clueless, Careless Cult, which is about recognizing social cues and teaching people to do that. So we'll be having some book readings that day. The voices of Froggy Tea and Bunny will also be in the house. We'll also have a guest singer coming that day as well. We have Dreams, which is a Black-owned ice cream shop in Glenside. They will be coming. So for like $20, you can get a book and an ice cream cone, but you can also buy ice cream by itself, and you can buy more than one book. So, and there'll be CDs and digital download cards for sale as well because of the musicians. So it's just going to be a wonderful day. I'm super excited about the book, obviously, and about all the books. I'll be reading about one or two and then showing the animation as well. So it should be a nice, beautiful day. And then we'll have some cupcakes or something to celebrate my dad's energy as well. And it'll be at the office at 5523 Green Street with an E on the end in the Philadelphia section. So I'll start promoting those on social media. So, all right, if you haven't joined the Ask Dr. Walls 525 page, we need you to do that to subscribe. We also, please subscribe to UCCN TV. That's UCCN TV on YouTube. We are so close to crossing the 1,000 subscribers mark. So please subscribe as family, friends. It is not hard to push a button. All right. Or just click or get somebody to click it for you. And we have season 3 of Kadaga. Brother Umoja, I can't believe you didn't mention that. Season 3 of Kadaga. I'm sorry. It's coming out June 12th.
At 7 p.m. Eastern.
Yes.
The first episode's coming out.
Yes.
And we all know who the lead actress is.
Of course we do.
So you've seen her.
On the serious tip, Kadaga is about women of color coming together to fight human trafficking in all its forms. So I'm using everyday people in our community. Yeah. We do have, I think, 2 actors as SAG. We don't use them in season 3, but we're using everyday people in our community to tell the story. But it affects us on many different levels. So the story is being done by local people who want to be in front of the camera and some behind the camera. And it's in 11 different countries.
Yeah.
We have,
So we have 11 different countries, 6 of which are in Africa, and 10 different states that we have people in the show, in the web series, excuse me. And to his point, right, where it's multifold. So it represents it is the official web series for our nonprofit Sisters for Harmony, because it highlights everyday women. So in the series, I am the lead actress, Lioness. Lioness is an author of The Adventures of Froggy T and Bunny, right? These are real books. These are real things. We also have other people who are social workers and therapists and photographers and people who work in the media, because it lets people know that we are in these roles. And it also, gives us a way to move in and out of this thing so that we can gather the intel that's needed. Unfortunately, Edmund and I have histories with people who have been trafficked in various forms, him providing security, obviously me providing clinical services. So it is something that has been real in our lives, sadly, but nonetheless, the more we heighten the awareness, our thinking is this: everything is energy. And the more we highlight and make people more aware of it, the more likely someone is to pay attention when things are happening, and then more likely to do something. Many years ago, I read in a book, and I wish I could remember the author. She said, it's not that there's more hate than love in the world, it's just that hate is doing a better job. And so for me, that is the charge, to do more and to do better. And the other thing was, it does not take 100% to tip the scale, it only takes 51%. So as long as we are each doing our part, like we are tonight, we are making a difference, and that difference impacts somebody else, which impacts somebody else, and so forth. So I thank you all for doing the work that you do and you continue to do, because you are the change makers that we need. So thank y'all.
Thank
Give
you.
honor to God.
Thank you.
All right. All
Honor
right,
to
y'all.
God.
Yes.
Thank
Until
you.
we meet again, God bless, and continue to live your greatest life. And we will see you soon. All right. Good
Thank
night,
you.
everyone.
Right.
Bye.
Thank you.